Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. BLS, that is a basic life support. We're looking at its algorithm. So the very first thing we need to do is we need to verify the scene safety. So we need to do a scene safety. Next, what is to be done? Next is to assess for the responsiveness of the patient. So we assess the responsiveness of the patient and you shout for help. So then you ask for help, you shout for help and you activate the emergency response system. So you activate the ERS and you bring an AED, that is an automatic external defibrillator. Automatic external defibrillator. And to the patient or ask for some nearby to do so. Next, what we do is after AED, that is an automatic external defibrillator or asking for help, then we do for the assess the patient's breathing. Then we move on to the assess the patient's breathing. So assess the patient's breathing or gasping. So you assess the patient's breathing or the gasping and check the pulse simultaneously and you check for the pulse. You check for the pulse simultaneously. So you check for pulse simultaneously for not longer than 10 seconds. So you check for pulse simultaneously for less than 10 seconds. Next, we look for the other conditions. That is, in terms of normal breathing and the pulse is felt. So normal breath and the pulse. If this is felt, what is to be done? Next is you monitor until the emergency response team arrives. So you monitor till the emergency team arrives. Next is if no normal breathing but pulse is felt. So in terms of no normal breathing. So no normal breathing but the pulse is felt. Pulse is felt. So in this case, you provide the 10 rescue breaths per minute. You provide 10 rescue breaths per minute. And this is one breath every 6 seconds. So it's one breath every 6 seconds. Next is to recheck pulse every 2 minutes. So we go to recheck. So there is a rechecking of the pulse. And this is done for every 2 minutes. And in case if there is no pulse, so what do? If there is no pulse, you perform a CPR. Then will be to administer naloxone. So you administer naloxone if available as per the protocol. And in cases of opioid overdose. So this is one scenario. Next we look at in terms of no breathing, only gasping and no pulse is felt. So in terms both have the value of no. So there is no breathing or there is no gasping or no pulse. So what you do is you start the high quality. So you start high quality and you perform the CPR and you perform the cycles of 30 compressions to 2 breaths. You use the AED, automatic external defibrillator, as soon as it is available. The next steps will be based on the AED. So as soon as the AED arrives, you check for the rhythm. So as you check for the rhythm, there is first step will be to, if the rhythm is shockable. So if it is shockable, you give one shock. So you give one shock and immediately resume CPR. And immediately resume the CPR for 2 minutes. So you resume the CPR for 2 minutes and you recheck the rhythm and you recheck the rhythm until prompted by the AED to allow the rhythm check. Then continue the ALS provide takes over or other victim starts to move. So it is, then you continue until the ALS provide or takes over, or the victim starts to move, or the victim they start to move. Next we are looking at a condition where the rhythm is not shockable. So we look at the rhythm, it is not shockable. So it is not shockable. So in this case you resume the CPR. So you resume the CPR and immediately for 2 minutes until prompted by the AED to allow the rhythm check. Next is to continue until the ALS it provides or takes over. So until the ALS takes over or the victim starts to move. Until the ALS takes over, takes over, or the victim starts to move, or the victim it starts to move. To learn and grow daily like this, please do subscribe.